Welcome back. Well, if a hospital learns about allegations that one of their employees is sexually assaulting vulnerable patients, do they have to contact police? The answer will surprise you. And so too will the lack of oversight when it comes to hospital employees that have the most intimate relationship with patients, personal support workers. Our Cynthia Mulligan joins us now with more on our top story. Cyn?
Avery, I'm standing here on Hospital Row, and your story this evening puts two major flaws in the healthcare system into very sharp focus, and advocates are calling for change.
We're fighting this battle on a bigger scale, but on a personal family scale, we lost the battle. We lost a family member to this. But on a bigger scale, we want to make sure this doesn't repeat itself.
A City News investigation has found Sonia Sheridan's family was fighting against a system that has gaps that leaves patients vulnerable. They claim they were told by Mackenzie Hill Hospital that their 90-year-old grandmother was sexually assaulted by a personal support worker who was later charged with a string of sexual assaults against elderly and frail patients. But the hospital did not notify police. In a statement today, the hospital said the patient that first came forward didn't want it reported, saying, "We respect the wishes of patients in matters such as this, and the patient involved did not want police contacted."
I'm shocked and outraged that a personal support worker in a hospital should have physically abused patients, and the hospital failed to report the local police department.
This case, according to the Advocacy Centre for the Elderly, highlights a critical flaw in the system.
If we look at other similar settings, such as long-term care homes, there is a mandatory reporting obligation. I don't see any reason why there shouldn't be a similar obligation on hospitals.
But there is another disturbing element to this case. The personal support worker was fired from Mackenzie Health after the hospital launched an internal investigation. But there is no regulatory body for personal support workers. Even though they bathe and care for many elderly patients, unlike doctors, nurses, and teachers, there is no one to report to if there are allegations of wrongdoing. The personal support worker was then able to get another job at other agencies, where he was also accused of sexual assault. Advocates have been calling for the province to set up a regulatory body for PSWs for years.
There is not enough oversight of PSWs. There's no body to regulate their conduct. There's no body to license them. When you have a bad PSW, there's no oversight of that person.
Now, late this afternoon, the Ministry of Health and Long-Term Care sent to City News a statement saying they have, quote, an expectation that hospitals will notify police of any potential criminal matters. However, that falls far short of saying it is mandatory. And the personal support worker has maintained his innocence all along. He did plead guilty to one charge of assault. All other charges were dropped.